Let's take a look at some of these elements around prescribing medicine. So the title of this is Deprescribing: How Building Lean Muscle Can Eliminate Medication. And I'm going to pause here for a minute so that those of you who want to can screenshot this. But let's just take a look at comparatively how exercise compares to medication. So in this case, the drugs for diabetes, the insulin sensitizers, Metformin and TZDs. So how muscle mimics or surpasses it. Muscle, contracting muscle translocates GLUT4. What is GLUT4? It's the doorway on the surface of your cells that allows glucose to come into the muscle so that you can make energy. Muscle also releases interleukin-6, irisin, and myonectin. These all improve glucose uptake and hepatic fat burn. So they prevent your liver from becoming fatty. Moderate exercise outperformed 1 gram a day of metformin for insulin resistance in prediabetes. This was a meta-analysis done that showed that HIIT training, the HIIT training is an acronym for high intensity interval training, and resistance training boosts insulin sensitivity similar to metformin doses. So what we're saying here is that exercise outperforms this because this costs money. Exercise doesn't. What else does this cost? This costs nutrients. It costs side effects, right? So one of the things we know, for example, metformin does is it causes B12, folate, and CoQ10 deficiencies. What happens when your B12 and folate are deficient? You have an increased risk of heart disease because these two B vitamins control a heart disease chemical called homocysteine. What happens when CoQ10 is depleted? Your blood pressure goes up. You can develop neuropathy. You can develop myopathy or muscle pain. CoQ10 deficiency can cause congestive heart failure. So, I mean, you're treating a disease that exercise could treat equally and effectively, but the cost of that treatment, beyond the financial cost, is to create malnutrition in the host that leads to the very disease that you're trying to prevent. Then we have antihypertensive drugs, the ACE inhibitors, the beta blockers, the angiotensin receptor blockers. So let's look at exercise. Isometric heavy eccentric lifts enhance endothelial nitric oxide, reduce sympathetic tone, and remodel arterial stiffness. So they basically make your blood vessels work better and dilate better. We know that resistance training cuts systolic blood pressure by 8 points. That's the top number. Comparable to first-line drugs, meaning it's comparable to these drugs. These drugs can lower your blood pressure by 8 to 10 points. Exercise, same thing. But you don't get the side effects. What do these blood pressure medications do? What are some of the side effects of blood pressure medication? So depending on which one you're taking, but ARBs are now being linked to celiac mimicry. What does that mean? Those of you who followed me for any length of time know my stance is on gluten, but these drugs cause villus atrophy or damage to the intestinal lining that is exactly the same. It looks exactly the same as celiac disease. And what does that cause? What is celiac disease? What does the damage to the GI tract cause? It causes malnutrition. And we're going to talk soon here about the nutrient components of building muscle and how important they are. But when you're taking a drug that causes malnutrition, don't you think it serves to say that the long-term consequence of the side effect, that medication, is going to increase the risk of the very diseases, again, that you're trying to treat? ACE inhibitors and beta blockers inhibit CoQ10. They affect zinc absorption, and zinc, plays a role in 300 or more enzymes that are responsible for regulating your hormones, for regulating insulin, for antioxidant function, for growth, healing, and repair. So is that what we want? Do we want to pay that cost? I mean, the answer to me is pretty clear. Then we get to statins or lipid-lowering drugs, and don't even get me going here. I think trying to lower cholesterol is like the stupidest thing in the world to do. That's my opinion. I know that's what a lot of people believe, but look how many years we've been trying to lower cholesterol for 50 years. We don't have less heart disease, but this is the #1 prescribed drug of all time in the world. Well, let's compare these drugs to exercise. Myokines upregulate chemicals raising your HDL, what they call the good cholesterol. They also clear out your triglycerides. Triglyceride elevations in the blood are increased risk for cardiovascular problems. So it acts as a triglyceride sink of sorts. We know that 12-week randomized trials, not 12-week randomized trials, 12-week resistance training reduces LDL. If you're trying to lower your cholesterol, reduces it 8 to 15 points, and it lowers your triglycerides 10 to 20 points. And in women, aerobic and resistance training, meta-analysis shows consistent HDL rise. So, I mean, comparable effects. It's just exercise. It's pretty simple. And statins, what do? They also block CoQ10. As a matter of fact, Merck, I think, is the company that learned that originally. They actually did the research that discovered that, and they have a statin that's patented with the addition of CoQ10 in it. A lot of doctors won't tell you that, but that's the reality. Then you've got NSAIDs and acetaminophen, so pain medications, basically non-steroidal anti-inflammatories. So let's compare exercise for pain. Exercise triggers endogenous opioids and endocannabinoids. And so how many of you are on this bandwagon of wanting to take CBD? That's what an endocannabinoid is. It's CBD. You make your own CBD if you exercise. It also helps you make interleukin-10 and resolves local inflammation without blocking this enzyme COX. COX is an enzyme in your cell membranes called cyclooxygenase. When you start blocking COX, the consequence to that is that it reduces the mucosal lining of your GI tract. And so basically it rips a hole, leaky gut, if you've heard that term. Leaky gut. That's what it creates in your gut. If so, you could exercise to help with your pain, or you could take an NSAID to reduce your pain, but you're going to cause leaky gut. Now, NSAIDs also cause a reduction of iron. They cause folate inhibition, and they can reduce vitamin C. And vitamin C is one of the most powerful anti-pain or anti-inflammatory nutrients that we have. So again, the irony is the medicine itself that's being used to treat the symptom leads to the deficiency that causes the very symptom. We look at network meta-analysis. Exercise equals NSAIDs for knee osteoarthritis pain relief. It beats opioids on function. And one of my own personal anecdotes or experiences, and I was guilty of it as anyone else, so don't think of this class as a scathing kind of me lambasting you guys for not exercising enough. We're all guilty of it at times in our life. I was too. There were times where I would sit at my desk for 8, 9, 10 hours sitting, and what started to happen, this was when I was in my mid-30s, is my knees started to hurt, and I couldn't understand why. I didn't injure them. I hadn't done any trauma, and I exercised at the time, but it was quantity. It was the long scale. I was sitting for so many hours over the course of the day that ultimately what happened was my knees started to break down. My knees developed arthritis, and you know what I did to fix it? It was a really simple solution. I bought a desk treadmill. They make them now. They're really inexpensive. You can buy them on any store. I'm not an affiliate for any of those companies, but just go look at them and find the one that looks good. They make them and they're really lightweight and they have wheels, so you can move them in and out of your way, even if you're not super strong. But this right here resolved my knee pain completely. It was just within a matter of days when I quit sitting for 8 hours straight. What I would do is I would walk for 30 minutes, and then I would sit for an hour, and then I'd walk for 30 minutes and sit for an hour. Sometimes I'd walk an hour, and I just alternated throughout my day, getting up and walking versus sitting. Completely reversed the arthritis that was forming in my knees, and completely reversed also the stiffness that I was developing in my back. So don't underestimate the power of setting your workstation up to accommodate yourself, right? And so you can, for a few $100s, it's not a lot of money for your longevity. It's not a lot of money in context of, is it going to preserve my knees? Is it going to preserve my health? So a treadmill, and I bought a thing that raised my screen. It was a device it was a hydraulic device that sat on top of the desk, and you could raise it or lower it. Mine's a manual one, so I didn't spend, some of these things you can spend a lot of money on. I just bought a manual one that would raise and lower my computer screen for me so that I could walk or sit. So again, hopefully that helps some of you. Let's look at antidepressants as a means comparative against exercise. So strength work boosts brain-derived neurotrophic factor, BDNF, and beta-endorphin normalizing monoamine tone. What is a monoamine? That's things like dopamine, which helps you feel good. 218 trial in the BMJ network reviews strength and mixed exercise outperform meds by 1 standard deviation on depressive scores. That's a tremendous, tremendous benefit over the medication. So they work better. Now, if you're taking these medications nutritionally, let's talk, since we're on this nutritional kick here, what do these medications affect? They affect calcium. They also affect folate and vitamin B12. So what does vitamin B12 and folate deficiency cause? Depression. So it makes sense that, again, the medicine you're using to treat the condition or the symptom leads to the nutritional deficit that recreates the very symptom. That's why a lot of times medicines don't work indefinitely. You have to go back to your doctor and they change your prescription or add more or increase the dose or whatever it is. Exercise. Then we have bisphosphonates, the bone drugs, and anti-osteoporotics. So mechanical loading activates osteocytes and WNT beta-catenin signaling, raising bone formation and mineral density. 12-month impact on resistance training equaled alendronate for hip strength endocysts in postmenopausal women. Let's think about that for a minute. Alendronate, what's one of the side effects of that drug? Is it erodes your esophagus. It's a very common side effect in my experience. I've seen a lot of women being told they needed to be on that medicine and then they had to stop taking it because esophageal erosions were too intense, which then leads to inability to eat, because now every time you eat you have severe heartburn, and so then these women that are losing bone are now malnourished because they're not able to eat as much food, and so their bone deterioration just continues on. But these bones also long-term make your bones brittle. These drugs do, and you don't want brittle bones. They increase the density in terms of X-ray absorption. And if you aren't familiar with my class on bone scan myths, I highly recommend that you go watch that class on bone scan myths and bone growth. But these drugs increase the risk long-term of fracture because they make your bone more brittle and they erode your esophagus. So that's the long-term nutritional consequence versus exercise. Exercise performs equally well. What about immune modulators and vaccine adjuvants? So exercise mobilizes natural killer cells, T cells and B cells, interleukin 7 and 15, rejuvenates the immune system's surveillance abilities. Reviews show that 150 minutes of a week of exercise cuts respiratory virus risk and severity, including COVID-19. That was studied. This is one of the benefits of the mass psychosis around those last 4 years, was that we did a lot of research on this, and what we found was some really great things, and one of them was that exercise reduces your risk. Appetite suppressants, so GLP-1 agonists, those of you, again, taking the Ozempic. Resistance training raises myokines, GDF-15, FGF-21 increases resting energy expenditure, preserves lean mass during fat loss. Trials report 5% body fat drop or more with high volume resistance training and weight maintenance, longer versus drug only groups. Again, you don't need to take a passive therapy to achieve benefit. And so think of all this. Now, how many people are out there, they're not just doing one of these things. A lot of people, they have high blood pressure, so they're taking one of these. They have diabetes, so they're taking one of these. They're also being treated for high cholesterol, so they're taking a little of this. Their joints ache a lot, so they pop a couple of these a week. And because they're doing all this and they don't feel good, they're probably on antidepressants. And then they get the diagnosis of osteoporosis. How many people are polypharmacy cases? Because that's really the core issue here, is that the vast majority of people that are taking prescriptive medications aren't just taking one, they're taking multiple. And what I've just shown you, and this is all research-based, what I've just shown you is that exercising outperforms medication for all of these things. Why isn't our medical community prescribing exercise instead of drugs? It's not profitable. If you go exercise and your disease goes away, it doesn't make money for hospitals, doctors' offices, and doctors' groups. At the end of the day, you have to understand they're a business. And there's nothing wrong with being in business, but there's something wrong with being in business to the detriment of your customer. And I think if we look at today's society, we have a lot of that. We have a lot of our healthcare industry, not all the doctors, not all the nurses. There's some great healthcare practitioners and providers out there. But there's tremendous pressure. A lot of these hospital systems are owned by corporations, and so there's a lot of management of doctors where they're being coerced, or they're being, we'll just say they're being corralled to do certain things to increase the profitability of the business. And you need to know that. That's what they're after. They're after profits, and that doesn't necessarily include your health. And there are no great outcomes in that model.